But good afternoon, everyone. My name is Paulina Ruiz, and I manage Project FIEL-NC, which stands for Fostering Insurance Enrollment Among Latinos in North Carolina. This is a project that's led by Latin 19 and includes faculty, staff, and students from Duke Margolis, Duke University School of Nursing, Family Medicine and Community Health, and the Department of Pediatrics. And this project is funded by the Kate B. Reynolds Charitable Trust. So our agenda for today, I'll start off with some brief background and progress to date for our overall project, including our selected counties and community infrastructure that we identified. And then we'll move into the main priority for the presentation today, which is to introduce our funded partnership for community-based organizations. And then we can open up to any questions and discussion. So for some quick background, lack of health insurance is one of the many systemic barriers to health services that results in disparities in health and wellness. La Comunidad Latina represents 11% of North Carolinians, but also represents about 1 in 3 people without insurance, which is one of the highest uninsured rates in the country. So this brings us to our project aim for FIEL-NC. We aim to increase enrollment of currently uninsured but eligible members of the community who identify as Hispanic, Latino, or Latinx in ACA health plans or Medicaid. And our project encompasses 3 key pillars being policy, education and training, and navigation and communication. And I'll introduce some of the key highlights of the progress that we've made so far. Keeping it brief, these are just the main highlights. We may come back at a later date with a more in-depth presentation, but these are kind of the main points for now. So within policy, we've selected counties for intervention, which I will show in a later slide. And we've also been conducting a literature review using the framework on the right, and then also conducting policy interviews to complement the findings of the literature review. Within navigation and communication, we just wrapped up our focus groups with community health workers to inform our education initiatives. And on the right, you can see the organizations that participated in that. And finally, within education and training, one of our key initiatives is to partner with the Latino Community Credit Union to offer an insurance module at their 15 branch locations. So in preparation for that, we disseminated a survey to their spring cohort to get some more information. And then we use the information from that survey and also the information that we learned from the community health worker focus groups so that we can develop and continue developing our materials for the partnership with the LCCU and for our own community health worker training. And as mentioned, these are the selected counties. So our policy group took a look at some publicly available census data and then triangulated 3 key indicators being population, poverty, and uninsurance. And then when triangulated, these counties in purple emerged as potentially having the most need. And the percentages that you see next to each item are the average total population, poverty rate, and uninsurance rates in these selected counties, and they are representative of state averages. And we have a poster that we'll be presenting at Academy Health around this methodology for the data. And if anyone's interested, we can come back at a later date and go into some more depth about the methodology behind this. But for now, we'll just kind of breeze through it. So our next step was to take these selected counties and then look at the infrastructure in each county and around the counties. So we included the LCCU branch locations, which I mentioned are 15. So those are the pins in red, and then the numbers on each pin is the number of organizations or branches. And then we also wanted to include organizations that are based in the community, serving Latino communities, and also have some sort of community health worker initiative or have community health workers on staff. So those are the pins in green. And this is a disclaimer, these are just the organizations that we were able to identify. So there may be organizations that are missing, and we'd love to add them to this list and to our work. So if you have another organization in mind that would be a good fit based on what I described, please let us know and we'll be happy to add them. And all this work kind of set as the foundation for the next stage of our project, which is what we're excited to present today. We're inviting community-based organizations that work with community health workers and have a focus on Latino communities to partner with us. And I'll go into some more detail. So we're inviting these community-based organizations to partner with us on a community health worker initiative focused on increasing health insurance enrollment among Latino communities, particularly in and around the counties that I shared on the map. So we're not excluding organizations outside of the counties, but we're just keeping it in mind as we're sort of mapping out our partnerships. And this is a funded partnership opportunity. And I also wanted to share that we're not only looking for licensed community health workers, we're also open to health promoters, health navigators. We know that there's a great variety of names and titles. Going slower. I see Viviana motioning over to me. Okay, I'll go slower. So we want to be inclusive of lots of different titles and roles within this health promotion work. So the aim of our partnership is to provide culturally appropriate training for community health workers that serve Latino, Latinx communities in North Carolina around health insurance so that they may provide community education and assist in health insurance enrollment efforts. So moving into some of the expectations or tasks associated with the partnership. On the community-based organization side, there's completion of contracts and submission of invoices in a timely manner. And those invoices would be twice a year. And then also the community health workers' participation in our training, which we're estimating to be about 6 hours. And then participation in surveys or other evaluation activities, and then tracking of the engagement related to health insurance after the training. On our end, FIEL-NC will provide the funding to cover the community health worker time, as well as administrative time related to the partnership, and then also offering assistance with some of this administrative work. So completing or understanding any forms or understanding any other tracking tools that we might use, such as Qualtrics or RedCap, and then offering follow-up support. So office hours, potentially additional training, and then also being flexible to the needs of the community health workers and the organization itself. So I'll just breeze through this. These are just some of the screenshots of the forms that are needed on the Duke side of things. So this is the vendor registration form. Some organizations may already be within the Duke system, so that this may not be necessary. We have this RSSA, which looks like a lot, but we'll complete it. And then we just ask the organization to review and sign. And then a statement of compliance. And then finally, this is just our timeline for our project related to this partnership. So now and in the summer of 2023, we ask that organizations indicate their interest, and then we'll have follow-up conversations, and then we'll work to prepare and finalize these contracts. And then in the fall, we'll have our actual training. So that is aiming for September. And then we'll also have some surveys before and after the training. And then from that point, continuing through the end of our project, we are hoping to have the community health workers that were trained engage in their communities and then track those engagement efforts. And then also ongoing support and evaluation so that we can measure the outcome of our training and of this initiative, and then that we can also be responding to the needs of the community health workers. And this is what I mentioned. To indicate interest, we ask that you please just have your organization fill out this short form. We have an English version and a Spanish version, and when I stop sharing screen, I can put those in the chat as well. And as mentioned, after we get the list of organizations that are interested, we'll be following up with some conversations and meetings, and then we'll work to kind of outline the more formal agreements. And these are the points of contact for FIEL-NC. So Viviana is our principal investigator, and then we also have Andrea Toomey as our co-principal investigator. And please feel free to reach out to me as well